Hi, I'm Dr. Kachi from NITMED Tutorials, in Nigeria International Trained Medical Doctors Tutorials based here in Abuja. And this is Mr. Desmond. And today we'll be taking some common clinical examination questions in the MDCN exams. Okay, so quickly start with the general physical examination. And we always begin our examinations with grip. Remember to always grip your patients, okay? Grip for greet, create rapport, introduce, and take permission. You must always greet, create rapport, introduce, and take permission from your patient, okay? So let's go. Good morning, Mr. Desmond.
Good morning.
Okay, I'm Dr. Kachi. I would like to do some physical examination on you. Can I go ahead, please?
Okay, no problem.
All right, so please, can you kindly take off your shirt and lay on the bed? Okay, as a rule of thumb, you must always remember to examine your patients from the right side of the bed, all right? So I'm on the right side of my patient. So always stay right, okay? So the examination, general physical examination, like every other examination, follows the protocol of IPPA. You inspect, you palpate, you percuss, and you auscultate. However, for general physical examination, percussion and auscultation will not come in this case, all right? So we just inspect and palpate, all right? So, and for general physical examination, remember, so that you are systematic and you don't skip out anything, to examine your patient from the crown of his head to the sole of his feet. So you go craniocaudally, you go in that manner so that you don't skip out anything, all right? So we go. A good clerksman is a good showman. You must be seen to be demonstrating, eliciting these signs to your examiner, because that's the only way you can be scored, all right? However, you only have 3 minutes for each station, so you must also complete your examinations which are required of you under specified time, all right? So when you're examining, always remember to recount the overall state of health of the patient. Is your patient apparently healthy or ill-looking? If it's ill-looking, is it acutely ill-looking? Is it chronically ill-looking? Or is it acute or chronic ill-looking? Okay? And if it's acutely ill-looking, is it painful distress or in respiratory distress? And if you state any of this, you must have evidences to back those. Okay? All right, so we inspect very quickly. So I'll first feel the patient's hair, check for the texture of the patient's hair, where you can pick out in diseases like chronic liver disease or chronic malnutrition, all right? So after that, I use the dorsum of my palm and place it on the forehead of my patient to check for the temperature, know if the patient is warm to touch or not, all right? So next, I use my thumb and my index finger. I elevate my patient's eyelids, all right? So Mr. Desmond, open your eyes, please. Thank you. Now, please, can you kindly follow my hand, my finger? All right, thank you. So this exposes the white part of the eye, the sclera, and with this you can pick out jaundice. You can pick out if a patient has jaundice by that examination. Next up, you use your both thumbs to depress the lower lids, okay? Depress the lower lids and examine for palpebral pallor, all right? So you look at the palpebral part of the conjunctiva and look out for conjunctival pallor, all right? So next up, you examine the mouth. Now, while examining the mouth, you must give your patients 3 instructions, which are open your mouth, bring out your tongue, and raise it up, all right? Open your mouth, bring out your tongue, and raise it up. So Mr. Desmond, can you please open your mouth? All right, bring your tongue out, okay? All right, raise it up. Even if you know what to do, remember that your examination is showmanship. You must show your examiner that you actually know what you're doing. Whether or not the patient is normal, whether or not you already know what you're looking out for, but you must act appropriately. You must show your examiner that you know what you're looking out for, all right? So follow your instructions. So next up, you examine for the cervical lymph nodes, all right? So the submental, the submandibular, the preauricular, anterior cervical, postauricular, occipital, all right? So you go in that manner, all right? So always examine for lymph nodes with the tip of your fingers, the palmar parts of your hands, all right? And you rub the lymph nodes against bony prominences. That way you can feel if those lymph nodes are enlarged. You can feel them rubbing against your fingers. Okay, so start with submental. Okay, so now submandibular. Okay, so preauricular. Okay, upper group of cervical. Okay, middle group of cervical. Okay,